As our coverage now continues with all those new restrictions now in place, we want to bring the best source of information straight to you right here to the RTV6 couch. Marion County Health Leader Dr. Virginia Caine joins us live this morning here in studio. Good morning with the official good morning. Dr. Caine, good morning. Great to have you here. So many questions. So, schools are closing in Marion County today.
That's correct.
Starting today. In Avon, they're closed. Wayne County schools in a couple of days. You're closing down large gatherings. Is that enough to slow down the coronavirus?
I think it's going to be significant in closing and reducing the number of cases of the coronavirus significantly by doing this tremendous amount of social distancing. You know, children, for example, have been considered great transmitters. And the fact that I can reduce that number of large gatherings, I think will make significant inroads in terms of the number of cases we can reduce with coronavirus.
Are you concerned at all about mixed messages? The state basketball tournament is still going on, no fans, but there's still a basketball game going on. At the same time, there are no NBA games. Are there any concerns about we can do this, but we can't do that?
So I think with the NBA games, the reason why they discontinued it is because they had at least 2 players who actually had the coronavirus. That, my knowledge, I'm not aware of any of those players that are playing have the coronavirus. And secondly, as long as you have a public gathering and it's less than 250 people and you're meeting that criteria, I don't think that's a mixed message.
Many of our viewers have questions, in particular the issue of testing.
Yes.
People want to know right now, do I have this thing so that I can protect myself and my family? In fact, one of our viewers by the name of Carrie wants to know, why is Indiana so far behind on the coronavirus testing? Are there different standards for Indiana than other states?
So, quite honest and frank, I think that we're no further behind in coronavirus testing than any other state because of the limited number of kits. So, despite some information given out that anyone can get a coronavirus test, that is not true. So, our Indiana State Department of Health have limited number of coronavirus kits. We now have most hospitals who are using commercial labs to do coronavirus testing, but even those commercial labs are limited. And our third fact, I just really want to emphasize to people, if you're symptomatic, your test is more likely to be positive. If you have no symptoms and you do the test, you may have a false negative. So we really need you to be symptomatic so that if you really indeed do have the infection, it takes a little while for your body to develop antibodies for me to detect that by a test. So,
so do you think if we were all being tested, that would create either more panic or a false sense of security?
I think it would definitely create a huge false sense of security because I'm doing the test that may be false negative if you have not developed any symptoms.
And the last thing you want as a public health officer is for me to think that I'm okay on a Friday, but really on Tuesday, I get sick.
Yes, exactly right. So we still have limited coronavirus tests, and we want to be very judicious in how we test folks. And so just want to really encourage all of our healthcare professionals know that criteria, and the public, please have an understanding that at least we can determine that you're a high risk. We do not want to use those tests needlessly, but we're hoping that we will get more kits to the state of Indiana. But until that happens, we have to follow the criteria that's presented out by the Indiana State Department of Health.
And final question, you're telling me to wash my hands, you're telling me to stay home if I feel sick. What more can I do to protect myself? I work with 2 amazing journalists on the anchor desk. I want to be safe, I want them to be safe. So what more can we all do, right? Either at work or at home to be safe? Beyond the washing of the hands, beyond staying home if I'm sick, what else could I do right now to help you?
I think the tremendous thing is to make sure that your work environment is safe. So that means you really need to frequently disinfect the surfaces that you touch frequently at your work setting. You know, if you're before a typewriter, hey, have you wiped your typewriter keys recently.
In the last 5 years, maybe, hopefully?
Well, what can I say? And just those frequently touched surfaces. So, you know, I'm going into a ladies' room and I'm touching that door surface. Is that being cleaned on a frequent basis? But stay away from anyone who's coughing, okay, appears to be sick. You need that 6 feet distance. I think other things like, for example, you may be someone who takes communion. You know that cannot be shared. You're at high risk for contracting an infectious agent, which could be the influenza, the flu, not alone the coronavirus. So things of that nature. But if possible, stay away from any non-essential public gathering that's greater than 250 individuals.
Dr. Virginia Caine with the Marion County Health Department, I want to thank you and all your public health officers, because I know that you folks have been working uber overtime. We want to thank you for being on the front line. We appreciate what you do every day. So I leave you this morning. Have a great weekend. Please come on back and give us an update, because I think the audience needs to hear facts from you.
You just, the media has just been fantastic in getting the message out. And so we really appreciate it. It's been very timely and very accurate. I need you to continue that fantastic work that your station does.
So do I have your promise that you'll come back and give us more updates? Because the viewers really need facts. They don't need us just yapping. They need to hear from you straight from what you know. So you'll come back and give us facts?
I'd love to come back.
Okay.
Thank you for inviting me.
Thank you. Have a great morning and a great weekend. Lauren, now back to you.
All right, Ralphie.